friends, I'm Dr. Natalie Crawford. I'm a board certified OBGYN and REI. So I'm a fertility doctor, and every single day I talk about your health, hormones, and your fertility. This channel exists so that you can help learn about your body, and I would love it if you would subscribe and follow along. Today I'm talking about a question that I actually hear a lot, which is, can I get pregnant on my period? There is a big myth out there that says you cannot get pregnant on your period and that it's one of the safe times. And although this might be true for the majority of people, it is not true for everybody, and it depends on a few different variables. Notably, how long your period is, how long your cycle is, if you have regular or irregular ovulation. And I think this is important because if you want to prevent pregnancy and you're not on any type of contraception and you're trying to use your cycle and track your cycle and use that as an idea of when you can prevent pregnancy, it's really important that you understand your cycle the best. So we're going to go through some options when it comes to cycle tracking and help you understand the answer to this question. So the short answer is yes, you can get pregnant when you're on your period, even though it's not likely. So how do you know if you're one of those people at risk? Well, let's just roll back and take basic calendar method, which is not my most favorite tracking option, but it's going to give you a sense of when you're ovulating and how this could be possible. So in general, when you have a period, that is when you're shedding the lining, and that's the lining that grew from the last cycle. By convention, day number 1 of bleeding is considered day number 1 of your cycle. Well, during this time period, your body has a group of eggs that is outside that vault from the ovary, and these are the eggs that you have for the month. One of these eggs is going to ovulate, and the others are all going to die. What will happen is as that egg is growing to maturity, it grows inside a follicle. And a follicle is a small fluid-filled structure we can see on ultrasound. Actually, the brain sends out FSH, or follicle-stimulating hormone, which is well named and gets the follicle to grow. Well, the follicle's growing and it makes estrogen, and this estrogen is what stops you from bleeding. So you will stop bleeding as this follicle gets to maturity. And this is known as the follicular phase. Officially, if we're going to be exact, your period, the menses, when your menstrual bleed, is the first part of your follicular phase. Now, when that egg gets to full maturity, it's going to make a peak estrogen level, and your brain doesn't actually know, it can't see what's happening in your ovary, but it can sense your estrogen level. So estrogen receptors are in the brain, and when your estrogen gets to that peak level, the brain says, oh my gosh, we must have a mature egg. And then the brain is going to send out a surge of LH, or luteinizing hormone. And this surge allows that follicle to rupture, the egg to be released, and for ovulation to occur. Well, what's going to happen after this is the follicle is going to reform and become a cyst known as the corpus luteum. The corpus luteum is essential for implantation. It is essential for pregnancy. The corpus luteum makes progesterone, and it makes progesterone dictated from LH from the brain. This time period, the second half of the cycle, when you have the corpus luteum, is known as the luteal phase. So during the luteal phase, you have a corpus luteum making progesterone. During the follicular phase, you have a follicle with a maturing egg making estrogen. You have no progesterone in the follicular phase by definition. Well, if we look at average, usually the follicular phase can vary in length. So you and me, we have different length follicular phases. But most people have a relatively standard luteal phase, which is going to be somewhere between 12 to 14 days. Standard convention in the calendar method says that it is 14 days. And we're going to take your total cycle length, if you have regular cycles, and we're going to subtract 14 days from that. And that is going to tell me when you ovulated, since ovulation is the start of the luteal phase. So if your cycles are 30 days apart, you're going to say 30 minus 14, I ovulate on day 16. So you would have a 15-day follicular phase, you'd ovulate on day 16, and then you would have your luteal phase. If your cycles are 26 days, well, then you're going to say you ovulate on cycle day 12, because you're still going to have that 14-day luteal phase. Well, what if your cycles are 24 days? Now you ovulated on cycle day 10. And what if your cycles are 22 days? Now you ovulated on cycle day 8. So you can see that the shorter and the closer your cycles are together, we tend to assume that you're going to ovulate earlier and earlier, that you have a shorter and shorter follicular phase. Now again, caveat, this is not perfect, and you can have luteal phase issues. And so if you're not tracking exactly when your ovulation is happening, you may not know this. But let's just use the data that we have. If all we know is when your period is coming, we can assume when ovulation is going to occur. And if you have very close together cycles, it's going to happen earlier. Well, the average woman is going to have a period that is around 4 to 5 days in length, but we definitely know that some women have 7 or 8 day cycles. So you can easily see how if you have a longer cycle, and if you're ovulating earlier, and if you have shorter cycles. So we can easily see that if you have a longer bleeding period and you have shorter cycles, meaning the number of days from one cycle to the next, suddenly you're going to be in a position where you very well could ovulate while you're still bleeding. So this idea that intercourse on your period is always safe is not true. However, the examples that I gave, you can see that the vast majority of them, that ovulation day occurred well after the end of bleeding, especially if you have a 4 to 5 day period. So for the vast majority of people, that's going to hold true. Another important exception here is that you have to have regular periods in order for this to be true or hold true. Because if you have irregular cycles, your bleed may not always represent that hormonal drop. And what I mean by this is that when you have a true menstrual bleed, this is coming from a drop in progesterone. As that corpus luteum dies, because it can't live that long, progesterone then drops, and this is the signal to your uterus that it is time to bleed and have a period. When you have regular, predictable cycles, this is an ovulatory thing, meaning you ovulated, you made progesterone, it goes away, now you have a period. When your periods start to get very irregular, suddenly you can have an increase in what we know as breakthrough bleeding. And the way I like to think about this is to imagine you have a cup. So what happens is as you have that egg growing in the follicular phase, estrogen is being made, and that is like the faucet being on. When you ovulate, the faucet is turned off because now you have progesterone. So that has no faucet, the cup is just totally full. When progesterone drops, that is the signal to dump out the cup and have a bleed. Well, if you're not ovulating, you might just have the faucet on drip because every small follicle, even when they're not growing to maturity, is making a little bit of estrogen. Let's say the difference is between 20 picograms of estrogen at your baseline when the follicles are tiny and not responding versus 200 picograms of estrogen at your peak when it's in maturity. But that 20 can add up. So if the faucet is constantly on drip, eventually what's going to happen? If I don't ovulate, I'm never having progesterone, I'm never turning the faucet off. So suddenly my cup is going to run over and I am going to have bleeding. Well, women who have irregular cycles might ovulate somewhere in there, but the cup still got too full, and you can have bleeding and then ovulate in that time frame and get pregnant if your cycles are irregular. So I always say no method of cycle tracking should be the only thing that we utilize if our periods are not reliable and predictable. So if you are thinking, hey, I'd really like to not be on hormonal contraception, but I really don't want to be pregnant, can I just time intercourse around my period? This is called natural family planning, and I'm going to do a follow-up video going into the methods in greater detail. But that is not going to be a valid option for you if your period varies every month. So if you look at your past few months, you're going to say, oh, my period was 24 days, then 34 days, then 21 days, then 38 days. That's not for you. We now cannot use your cycle because I can't predict forward from it, at least with vast majority of methods. If you don't really know what your cycle is, if you're one of those people that says, my cycle comes probably every month, we should know that before we decide. So step number 1 for you is going to be use another form of contraception, use a condom, use something else, and then track at least when the day 1 of your cycle is. This can either be on a paper calendar, this can be on an app. There's a lot of different options that you can use. And there's even more sensitive options for cycle tracking using fertility awareness methods, which are body's physical signs, such as cervical mucus and temperature, or detecting that LH surge, to help us know when we're actually ovulating. That can make this a lot more targeted. But in general, the answer to the question, can you get pregnant on your period? You can. Is it common? No. Does it require you to understand your cycle in order to know if you're somebody who could have intercourse on your period and have it be safe or unsafe? Yes. I hope this video helped you learn a little bit more about your body. So thank you so much for following along. Please feel free to like, subscribe, share, and comment down below. We get all of our topics from your comments. Also, I want you to go ahead and subscribe to the newsletter at nataliecrawfordmd.com/newsletter. You're going to see a new freebie coming up and exciting updates about the As a Woman podcast, where you can get longer form content of all your fertility needs. Stay tuned and check out the newsletter so that you can get updates soon. Thanks.